Hi friends, this is Dr. Abdequaem from Grace Healing Homeopathy. As I have done few of the parts of fear rubric, part 1, part 2, part 3. So there were a lot of messages on my social media that sir, do something more about fear. See, it's a very interesting topic because in every case, if you ask fear, a patient will tell you something about fear, some fear he has. Everybody has got some part of fear in him, and that comes out beautifully when your case taking is good. So I think it's quite obvious that a lot of people have told me to do something on fear also. So I'll just do the part 4 of fear and let's see how does it go. So today I'll be doing fear. Now there is one more fear which is very commonly seen in a clinic. You know, the patient says, especially you will find this type of fears more in childhood, you know, and the mother comes and tells you, my son has a lot of fear of strangers. ये किसी के पास जाता ही नहीं, आदमी देखता घबरा आता अंदर आया था. Fear of strangers, you know, a very important symptom. Fear of strangers. किसी अनजान आदमी से मिलने को डर लगता है, देखने को डर लगता है, वहां से जाने को भी डर लगता है अनजान आदमी से. और जब भी ऐसा फियर हो दोस्तों, तो एक रेमेडी आपके दिमाग में जरूर आनी चाहिए और वो है ब्राटा कार्प. ये सबके दिमाग में आती है नो, फियर ऑफ स्ट्रेंजर्स. इतना ज्यादा फियर कि वो घर में अगर कोई मेहमान आता है, उसने पहली बार देखा है तो वो अपने फर्नीचर के पीछे चले जाएगा, मम्मी के पीछे छुप जाएगा, डैडी के पीछे छुप जाएगा, छुप के देखेगा. फियर ऑफ स्ट्रेंजर्स. You must think about Brata Karp. But you'll be surprised that there are some remedies which we don't think that this remedy should have that fear, but this remedy has fear. That is, you must think about Cuprum metallicum. You must think about Thuja also. And you know, Cuprum metallicum, if you want to take that rubric in your repertory chart, fear of strangers, especially, दोस्तों लिख लीजिए अपने मटरमेडिका में, जब भी बच्चों को डेंटेशन के टाइम पे, जब दांत निकल रहे हैं, ड्यूरिंग डेंटेशन, इफ देयर इज फियर ऑफ स्ट्रेंजर, माय डियर फ्रेंड्स, प्लीज first think about Cuprum metallicum, because I am telling you, so many cases when there is fear during dentation, we think about the dentation remedies, we think about chamomilla or calcarea phos or other remedies. Of course they are there, but fear of strangers during dentation, you must think about Cuprum metallicum. There is one more fear that comes to my mind, that fear of suffering. You know, I had a case where after COVID, you know, he had taken a lot of, there was a person, the father, who had taken care of his father, his mother, his neighbors during COVID, and he has seen that suffering, you know, patient going to the hospital, putting that oxygen mask, taking injections, coming home, weakness. So बोलता डॉक्टर साहब मुझे इसलिए डर लगता है सफरिंग का कि मेरे को ऐसा हो गया. तो फियर ऑफ सफरिंग कि मैं भी एक दिन बिस्तर पे लेट जाऊंगा, फिर खाना नहीं खा पाऊंगा, आई नॉट बी एबल टू ईट, आई नॉट बी एबल टू गो टू द वॉशरूम, somebody has to accompany me. I have a lot of fear of suffering, you know, and you must have also seen this in your practice. Fear of suffering. There are so many remedies. I have found wonderful results, my dear friends. Please write down in your Matermedica. Found wonderful results with Hiparsulf, Eupatorium perfulatum. I have found good result with phosphorus, calcarea carbon, chamomilla. Fear of suffering. You know, a robust person, a fearless person, and he was. And now he has fear of suffering. You know, kya honga mera. So this is again a very important thing. Of lately you will get lot of symptoms, lot of patients in your practice, fear of suffering, my dear friends. So do take this rubric. Of course, it's not always that you basically would take whatever remedies I have told, but this is my experience I'm sharing with you. So use this in your practice so that you can be a better prescriber and go to reach a similar level. कभी कभी नो एक पेशेंट आके बोलता, डॉक्टर साहब, मदर बोलती, मेरे लड़के को हर चीज से डर लगता है. माई सन इज अफ्रेड ऑफ एवरीथिंग, यू नो, and this even butterfly comes to our garden, he has fear. Somebody loud noise, he has fear. Not getting good marks in studies, fear. Not preparing for exams, fear. So fear of trifles. Fear of trifles. Again, this is a very important rubric. Fear of trifles. Think about arnica, think about kalikarp, think about lycopodium, think about nitramure. fear of trifles, हर छोटी बात में डर लगता है. So this is another part of fear that you should understand, and you will get this in your practice. Every patient, if you probe fear, something will come out from the case taking. So my dear friend, if you like this video, do share and subscribe. Thank you.